Let me just begin by asking you, in your own words, to, if you hear the word diabetes, what comes to mind?
People that have a very serious health problem.
And you're a nurse.
Yes.
So what do you see?
We see a lot of diabetics, and we see a lot of non-compliant diabetics. We see a lot of diabetics that do take care of themselves and do what is right. Our non-compliant diabetics, we try to get under control and get them to an endocrinologist if they're not doing as well as we would like for them to do. We usually use a group out of 2 below that we send our patients to. We try to emphasize to them the importance of keeping their diabetes under control, having their hemoglobin A1Cs checked every 3 months, try to explain to them what that test is and what it's telling us and telling them about their diabetes. We emphasize to them the different problems they're going to have if they do not keep their diabetes under control. That they are going to have problems with their eyes, they're going to have heart problems, they're going to have kidney problems, they're going to have diabetic neuropathy, which is going to cause problems with their extremities, feet, hands, peripheral artery disease, and try to make them understand what can happen to them if they do not keep their diabetes under control.
So take just a minute and tell me about the positive side. The people who are doing well with their diabetes, what does that look like?
Well, it's people that are keeping their hemoglobin A1Cs below 7, and they are not having as many problems as the patients that have hemoglobin A1Cs 9 or 10. You know, they are eating healthy, they are exercising, they are taking their medicine correctly, they are coming to the doctor as they need to, and like I say, they're taking the medicines, dieting, exercising, and doing what diabetics need to do to keep their diabetes under control.
Now, what do you think makes the difference between a person who does well with the disease and keeps it under control and the person who doesn't?
You know, that's a good question. You really don't know why some people are more compliant and others are not. Some of it is environmental. You know, some of them have not been taught. You know, and that's our goal, is to teach these people, you know, what needs to be done. And like I say, a lot of it is environmental, and a lot of them just don't understand it. You know.
How can we do a better job of teaching?
Well, and that's the responsibility of everybody in the county, the doctors, the social worker, the nurses, the healthcare providers. We all need to do a better job with our patients and explaining to them what needs to be done. You know, a lot of them don't even know. They know that they're supposed to come in every 3 months to get a blood test for their diabetes, but they don't really understand what their hemoglobin A1C test is and what it's really telling us.
Could you tell me what that is?
It's a test that's done every 3 months that tells a diabetic what their blood sugar is averaging every day. It's done every 3 months because your red blood cells live for 3 months and your insulin clings to your red blood cells. So we do it every 3 months to get an idea of what a diabetic's sugar is running every day.
Nice explanation. Thank you. I like to have you tell it rather than me tell it.
Yeah.
Excuse me. Why do you think, you know, motivation is certainly one reason why people do well.
Right.
You know, they're highly motivated, whether that's a personal factor or someone in their family that might be supporting them. But sometimes when we look around the community, there are things that sort of encourage people to do better and some that kind of put roadblocks in the way. Right. What do you think about what's going on here in Macon tonight? I'm sorry, Macon, in Noxubee County.
Well, like you say, some people do have more support at home and are more self-motivated, and they are the ones that do better. Undoubtedly, we don't have as much of that as we would like in this county because we do have more non-compliant diabetics here than we do compliant diabetics.
Do you think it's the cost factor, or do you think it's an education factor?
I think it's the education factor, a lot of it. And like you say, a lot of people are not motivated, and they don't have the support system. But then a lot of them that are compliant have had family members with diabetes that weren't compliant. So they have learned from that and seen that. But then some of our non-compliant have had family members that have not done well, but they're still not motivated to do what's right.
Do you have diabetes in your family?
No, I don't.
So you don't have any personal family experience?
Mm-hmm.
Any close friends?
No.
So most of your relationship with diabetes comes through your work.
Right, through my patients, right.
Can you give me an example, a story perhaps, of a person who maybe changed their way? They started out not doing too well, and then you gave them some education or some tips, and they kind of turned around what they were doing.
Oh yes, we've had a lot of people like that. We had one patient who's that I can think of that her hemoglobin A1C 1 month was 10.2. And I told her, I said, you have got to do something about getting this down, and I told her all the problems she was going to have. So I got her some educational material. We do have some diabetic educators that come in with our drug companies, and they leave me materials from time to time. And I've got another lady that's going to bring me some more material here soon because I'm about out of it. But we try to give our diabetics educational material, diet information, exercise information, a log book to keep a log of their testing. I did all that with this patient and told her that she needed to start exercising, she needed to start eating correctly, she needed to start taking her medicine as prescribed. The doctor did add another diabetic medicine to her, so that I'm sure helped some too. But the next 3 months when we checked her hemoglobin A1C, it was down to 7.8. And that was wonderful. And I was just so proud of her and told her, how excited I was and that she could get it down even lower, she had lost weight, she felt better, she was very proud of herself too. So, and we try to do that with all of our patients. Like I say, we had a patient not long ago whose hemoglobin A1C was 12. And I just was so upset, when I called that patient and I said, you were just going to have I tried to explain to her what was going to happen, And of course, we sent her on to the endocrinologist because she needed to get on insulin. And a lot of the times with our family practice doctor, he does send them on to an endocrinologist to get them started on insulin. Mm-hmm. But she definitely needed to get started on it.
So I didn't ask you at first, but do you work at the hospital?
I work at the clinic here in Macon.
Okay, so you're here at the clinic. Right. So is the cost factor a problem for people? Or
I don't think so. Most of our patients have Medicare and Medicaid, so I don't think the cost is not a problem for most of our guys.
And do you give people the education immediately with the diagnosis, or do they have to come back in and get the education?
No, I tell you, we very rarely have any new diagnosis of onset of diabetes. We've had maybe 2 since I've been working there. Most of our patients have been diabetics for a while.
Okay.
But now usually when we do have a new onset of diabetes, we usually will send that patient on to an endocrinologist to begin with.
Okay.
To get them started. And then we will see them back and follow them after that.
Okay.
And keep up with their A1Cs and send them back as needed.
But what about how long have you worked in this agency?
8 years.
Okay. So I'm kind of guessing, and I could be wrong, but I'm kind of guessing that there's probably a lot more people out there that have diabetes that aren't coming in.
Probably.
And not diagnosed.
Right.
So how do we get the message, and young people, children? Are you seeing any children?
No, we really don't. We don't. We don't see any pediatric diabetes.
Okay. And I know that, one of the big concerns right now is that this group of young children that are overweight and obese are really very much inclined to have or to get type 2 diabetes in the future.
Right.
Is the clinic doing anything to kind of get prevention messages out?
Well,
maybe with the health department? Is this a different clinic?
No, this is a different clinic.
Okay.
This is not the health department.
Okay.
Well, we are doing, I'm not sure what the school is doing and what the school nurse is doing. The school nurse should be doing some type of stuff like that, if they're not. I know that our social worker does a good job of trying to get the message out about diabetes. We've got diabetes classes going at the hospital. I think that the young children, when they come in for the doctor, to see the doctor, if we think there might be, if they're showing signs and symptoms of diabetes and they are obese or have a family history of diabetes, we do screen them for diabetes, if they've had symptoms, and but the school nurse, they really should be doing something at the school to help with the children that are overweight and let them know about diabetes testing.
And do you know if they are or not?
I don't know.
Okay.
I don't know.
Okay. All right. That's helpful to kind of get a view on that. What kinds of things do you think might be useful in the community to prevent diabetes?
To prevent diabetes, well, exercise and diet program, especially, like you say, with our youth, eating right, that sort of thing, to keep people from getting diabetes.
And how do we get the message out?
Well, we need to have health fairs. We need to have events to get people interested and get people involved and get people educated. We need to do screening and testing for diabetes at these health fairs and have information for families about diet and exercise and prevention of diabetes.
How about in the community? I've just been informed by a young woman who's told me that there's a new McDonald's in town.
Yeah.
All right, so how do we, that's jobs, it helps the economy.
Right.
So how do we balance that with the fact that we need people to also know about eating healthy and making wise choices?
Well, that's why we really need to get more involved in the community and get out there and get the message through. Go into the schools. Have health fairs that we can get families to come and get more involved. Just be more determined to get out there and educate people.
So is the biggest part of your job doing diabetes education? Or?
No. We're just a family health care clinic, and we do a little bit of everything.
Okay, so
but we do have a lot of diabetic patients.
Is there a dietitian or a nutritionist here?
At our clinic, no, it's not.
Here in Macon or in Noxubee County?
I think there's one at the nursing home, I believe. I believe there's a dietitian at the nursing home.
Okay. They're kind of a rare breed.
Yeah.
Okay. I think I've asked you about all the questions I need to. Is there anything else that you want to add before we conclude here?
This is something that I really, really am concerned about for this county and care about. I will graduate in May with my nurse practitioner's degree.
Oh, great.
And my project that I'm going to do will be on diabetes.
Excellent.
And because I told them, I said, we have so many diabetes in Knoxville County.
Yes.
And that's, and of course, I'm going to come back here and work. I've already, they've already told me they want me to come back here and work, which I'm so glad. I do. And I care about this county, and when you live here, you do. You care about the county and the people that live here. And because we do have so many diabetics here, it's very important that we help these people and prevent more people from getting diabetes.
Absolutely. Where are you getting your
MUW, Mississippi University.
Okay, excellent. So I think, I know Marika and others at the coalition would love to have you be involved and really get engaged.
Yeah, well, I want to. I really do.
Okay, I want to give you a brochure that you can take with you and learn a little bit more about what we're up to here, because I think you're going to have some great skills and abilities to kind of add to all of that.
Yeah, well, I hope so. I really want to. Like I say, it's a real concern for the people here. I mean, it's a problem. It's a real problem.
And not only is diabetes in itself a problem, but it's linked to so many other things.
Exactly. I mean, that's what we try to emphasize to our patients, that they're going to have a lot of problems if they don't get it under control. I mean, like I tell my patients, diabetes is not a death sentence. I mean, you can live a perfectly normal life, and you can live for years if you will just do right. If you do what your physician tells you to do, if you will take your medication, if you will eat properly and exercise and go get your eyes checked and go have your cardiac evaluations and have your lab work done, that you can live a perfectly normal life and be healthy and live to be as old as you want to. It's not a death sentence.
Yeah, and that's a perfect message.
Yeah.